This is a 61-year-old who has had an issue with chronic venous insufficiency as well as secondary phlebo lymphedema. Had a wound that was open for about almost 5 years.
Almost 5 years.
Yeah, 5 years. So he was willing to tell his story because it actually healed up a couple of months ago, and it only reopened up, after a little bit of additional swelling and weight gain, but we're getting that under control. But if you can kind of see the wound where it is right now, and still got a little bit of zinc oxide around there, the wound's just about that big. When he first came in to see us, it was about that big. So I'm gonna let him tell a little bit about his story.
I guess I thought it began with more of an impact wound to my leg, rather than an ulcer forming, but I really don't know because I can't see where it's at. But eventually it grew in size to where I was in a vehicle accident. I got rear-ended on 275, where everybody gets. But the guy recommended I go see a wound specialist, and I was referred to the wrong folks. But I saw them for about 7 months, and then they left me on my own recognizance. They basically said there was nothing else they could do for me. So my wife was basically my caregiver for a period of about 4 years, changing out the dressing, putting on the compression stockings, which many times literally tore the wound back open as we were putting them on, which probably didn't help the healing process.
Yeah.
And then my legs got swelled pretty big. I was about 26 inches in circumference on my left leg that had the wound, and asked for another referral. And I got to see vein and vascular Dr. Kerr, and he recommended me to Dr. Lamb, who actually knew what to do to get my wound better. And so about October of 2017, Dr. Kerr did the surgery that the other folks said they couldn't do on my left leg, stopped the drainage right into the wound, which helped the discharge. And Dr. Lamb's procedure shrank my legs and subsequently shrank the wound down to where it completely closed. Included a couple of PICC line procedures, which I wouldn't recommend. Nothing fun about having a tube hanging out of your arm and mixing your own antibiotics. But we got through that. We did about 6 to 7 weeks, I think, and the infection seemed to have cleared, and we did get it clear on one of the lab results. Yet about 3 weeks later, it had come back, so we had a new PICC line and a new regimen of fun there for about another 6-7 weeks, but we've managed to avoid those since. And even though we did get a little more swelling and the wound opened back up, we haven't got the infections. So
yeah, it's been good.
We're well on our way back to closing it.
Yeah. So there's really not a whole lot else that we have to do here. There's only a little bit of the wound left open here. Can I have a 15? And he's had manual lymphedema decongestant therapy already, so some massage work. So even about 6 weeks ago, you couldn't see this tendon, you couldn't see some of these veins. He was so swollen. So I'm gonna turn your leg just a little bit that way. So again, not a whole lot left to do. He's looking very good overall. And we're going to continue with just adding a little collagen and an Uniboot on it.
Collagen and
Yeah, the Fibricol. Let's do the Fibricol. And so we'll add, we'll do the dressing, apply on the Unabu compression, and then he'll be back here on Monday to get some more massage therapy. But overall doing pretty well, and I think he'll be completely done within 2 weeks.
Cool.
All right, very nice. So that's it for his case. Thank you so much, and please subscribe to the YouTube channel.